Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What are the first signs of flu? When you get the flu, influenza, it will often start with mild muscle aches, a slight tickle in the throat, or a worn-out feeling you just can't shake. Common wisdom suggests that if you treat flu when symptoms first appear, you may be able to shorten the duration and severity of the illness. In recent years, a number of prescription drugs have been approved for just such a purpose. /r/n/r/n Even if you are unable to get these medications, by recognizing the early signs and symptoms of flu, you can act quicker, not only getting the bed rest you need, but to take steps to prevent the spread of infection to others. /r/n/r/n Very well, Ellen Lindner /r/n/r/n Spotting the early signs and symptoms of flu can help you seek treatment that can shorten the course of an infection. The most common early symptoms are /r/n/r/n Once full-fledged acute symptoms develop, there is really nothing you can do other than rest and let the disease run its course. /r/n/r/n The flu is caused by a family of viruses that affect the respiratory system. Unlike colds, which can be caused by any number of different viruses, including rhinoviruses, adenoviruses, and coronaviruses, flu is caused exclusively by influenza viruses, designated as influenza type A, B, C, or D. /r/n/r/n When flu symptoms first develop, it may be hard to differentiate them from the early signs of a cold. But, there are a few key ways to tell them apart. /r/n/r/n Flu viruses almost invariably have a shorter incubation period, meaning that symptoms tend to develop fast and furiously, usually within a day or so. Because of this, the immune system will respond more aggressively, flooding the body with inflammatory compounds to help neutralize the virus. /r/n/r/n This aggressive immune assault will manifest with symptoms that are usually more severe and or less characteristic than the common cold. /r/n/r/n Influenza develops in stages, the early stage of which is referred to as the incubation phase and the latter of which is known as the acute phase. /r/n/r/n The incubation phase is the time following exposure before symptoms first appear. It is during this phase that the virus will actively replicate and, by doing so, trigger the release of defensive proteins called cytokines. Cytokines are pro-inflammatory, meaning that they spur the body to generate inflammation so that tissues and blood vessels can swell to accommodate larger immune cells, known as monocytes. /r/n/r/n In the latter part of the incubation phase, subtle symptoms will start to develop. These early symptoms are referred to as prodromal and serve as a warning sign of a developing infection. /r/n/r/n After the prodromal phase is the acute phase, which lasts for around 2 to 3 days with all of the classic symptoms of flu. Most flu symptoms will disappear after about a week, but a cough may persist for up to 2 weeks. /r/n/r/n Get our printable guide for your next doctor's appointment to help you ask the right questions. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n The flu can usually be diagnosed by symptoms alone, particularly during flu season. This is especially true with the prodromal flu symptoms, during which treatment will often be dispensed presumptively. Even if a rapid influenza diagnostic test, RIDT, is available, the test is not all that sensitive and can regularly return false negative results. /r/n/r/n To prevent complications and the further spread of infection, certain prescription flu medications can be dispensed over the phone by a doctor or a telehealth physician without a face-to-face meeting. /r/n/r/n. Unlike the common cold, for which there are no drug treatments, the flu can be shortened by a day or two if certain antiviral drugs are taken within 24 to 48 hours of the first appearance of symptoms. The drugs work by slowing the replication of the virus and, by doing so, potentially reduce the length and severity of the illness. /r/n/r/n. Even so, the drugs don't always work, often because people miss the early signs and get treated too late. If not taken within the first 24 to 48 hours, the drugs will not likely be of any benefit. /r/n/r/n. The 4 antiviral treatment options approved by the U.S. Food and Drug Administration, FDA, are /r/n/r/n for people that are at high risk of flu complications, including young children, the elderly, pregnant women, and people with chronic health conditions. Taking an antiviral drug can mean the difference between being hospitalized and recovering at home. /r/n/r/n. Relenza, Tamiflu, and Xofluza are not substitutes for the annual flu vaccine. /r/n/r/n. The best way to deal with annual flu outbreaks is to avoid infection. The most effective strategy for doing so is getting an annual flu shot or flu mist, the nasal spray flu vaccine. The Centers for Disease Control and Prevention, CDC, recommends annual influenza vaccination for everyone 6 months and older, ideally by the end of October. /r/n/r/n. The severity and duration of flu symptoms can be reduced by taking antiviral drugs within the first 24 to 48 hours after symptoms begin. This is because the antiviral drugs work to slow the replication of the flu virus. This is especially important for people who are at high risk of flu complications. /r/n/r/n. There are currently 4 antiviral treatments used to treat influenza: /r/n/r/n. Antiviral medications work best if taken in the first 48 hours after symptoms begin. /r/n/r/n. Over-the-counter cold and flu medications can help to relieve symptoms, but they don't shorten the course of the illness. Combination flu medications sold over-the-counter typically contain an analgesic, cough suppressant or expectorant, an antihistamine, and decongestants. /r/n/r/n. The influenza virus has an incubation period of 1 to 2 days. Symptoms tend to come on rapidly over the course of a few hours. For instance, you may feel fine when you wake up in the morning, gradually feel worse throughout the day, and have full-blown flu symptoms by evening. Similarly, you might go to bed feeling fine and wake up feeling undeniably sick with body aches, headache, and fever. /r/n/r/n/r/n/r/n. Thank you. Form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.